I'm here with Lucy again to go over some techniques that I use to help relax the pelvic floor or help the pelvic floor learn to yield. I oftentimes use this technique with people who are having signs of pelvic pain, maybe constipation, and this can be men or women who have pain maybe near their rectum or vaginally. And so I'm just going to go through how I've kind of worked through the process of coaching this. So the actual exercises are pretty familiar. They're really common stretches that you'll see, but it's the breathing, it's the coaching and cueing of the breathing that I've really found has made a big difference in how effective these are for me. So first I'm going to go through, let's see, let's actually do child's pose first.
Okay.
So go into child's pose, and I'm going to have her get into a really simple child's pose. So I don't want, a lot of people will get into this position if they've had experience in yoga, and yet they'll go really wide with their knees and come down. That's not what I'm looking for, because I'm really looking for them to block their belly so they don't get that big belly breath. The problem with the belly breath is you need air to get all the way, well, not air, we need the pressure of the breath to get all the way down to the pelvic floor. And so if they end up extending their belly, then we're not going to get the air to go all the way down where we need it to, or the pressure from the breath to get all the way down where we need it to. So what I'm going to have her do is get into a knees together child's pose, and where she's lying her belly on her thighs, and if she needs to put her head down, I want her really, really comfortable. So in this position, I'll probably lower her chest down even more and just get her really comfortable. Some people, I'll prop them up. I'll prop them up with pillows. Actually, put your hands forward, like just right down like that. With pillows between their thighs and their bellies, just depending on their position, because I need them to be super, super comfortable. The more relaxed someone is, the more their body will allow them to yield to the pressure of the breath. So Lucy, what I want you to do is I want you to take a breath in here and take 5 breaths. And what I want you to feel is as you breathe in, I'm gonna touch on your bottom just a little bit, okay? Mm-hmm. So just right at her sit bone. So I'm just gonna cue her with just fingertips, and of course I would ask before, right where her sit bones are. And what I'm going to say is, as you breathe in, I want you to feel your sit bones spread apart as you breathe in, and then they'll just gently come together as you breathe out. And just take a couple breaths just like that. And then afterwards, I'll say, could you feel that? Could you feel those sit bones coming apart, Lucy? Can you feel that?
A little bit.
Okay, so for her, I can see that she's not getting a lot of, you can usually see it in a lot of people. You can see that motion. And in this position, she doesn't get a strong feeling of it. 2 things. If I feel like she gets it enough, I'll stick with it. But if I feel like she needs a little bit more, I'm going to change the position. So what I'll first do is I'll put something under her legs. So let's try that. Let me go get something. Okay. So I'm going to essentially put her in a position that her body may be able to relax a little bit more and yield a little bit more. And I'll say, does that change the feeling? I'll let her take a few breaths and kind of practice it. One of the things, as she's taking these breaths and kind of seeing, I'm just going to talk through some things that I see in this position where I'm not going to let them go on. If they keep coming up off their thighs to take breaths, they're not ready for it. And you can't cue someone into being able to, you can try once or twice to cue them to stay on their thighs, and sometimes that works, but sometimes people feel suffocated, and if they feel like they're suffocating, they're not going to relax in the position. So you have to change it up, because this is all about relaxation. So we're not trying to force any positions for her. We're just trying to say, this is what I want you to feel, can you do it? Can you feel it here? Mm-hmm. Okay, so this was a good change for her. If it still didn't work, what I would do is I'd put her in a sideline position, preferably right sideline. So let's go ahead and show that. So I'm gonna get her on her right side, legs up, and I'm gonna do the same thing, and I'm just gonna say, in this position, As you breathe in, I want you to put the air all the way down into your bottom. That's just the best terms to use with people. And see if you can feel those sit bones coming apart and together as you breathe in and out. How's this position for you?
It almost feels like only my left one, like my top one.
Right, and that would actually be great. If someone who didn't move, that I would be all for that. I'd be for any kind of motion, because some of these people who have this pelvic floor pain and pelvic floor contraction that's not letting go, any kind of feeling, even asymmetric to start with, is okay. So, but with Lucy, the other one worked better, because what we can do is we can flip her on her other side and see if she feels it, and we can support her under her abs or anything like that, any sort of support to help her system relax. So if you see in any of these positions, if you see the person holding a tension somewhere, find a way to support them. Nothing is like a perfect way of doing it for every person. You're going to try to see what that person is guarding and figure out how to allow that guarding to relax. So it might be pillow between the knees, it might be holding a pillow at their belly, all of those things to get them to be as comfortable as possible. So one more that I'm going to show you guys that I really like, and this works well for some people too, and everyone's going to feel it a little bit differently. It may be based on their body type, and so it's good to have a few of these to play with. So what I do is I start out with their body type, and I say, okay, this, people with that are narrower in their torsos, that have that narrow build, I usually try first in the child's pose that we just went over, and then if they're a little bit wider angle, I'm going to start them in a happy baby pose. So go ahead and roll to your back. And you're gonna lift your legs up and grab the inside of your arches and take your legs out. And the first thing I'll say is, do you feel a little stretch in your thighs? Mm-hmm. And yes, and they'll say yes. The reason why I ask is because otherwise that's what they're gonna tell me, because it could be a really strong sensation. So if I don't mention it first, then it's gonna come back and they're gonna be like, all I feel is the stretch in my thighs. So I'm just kind of like knocking that out. So then, can you come a little wider with your knees by chance? Good. I really want it to be a relaxed kind of fallout. I don't want them holding any kind of tension. So now in this position, think about bringing that air all the way down to your back and to your butt. And see if you can feel those sit bones moving out as you breathe in and together as you breathe out. And make sure that they're not trying to force them together as they move out. It's just a natural motion. As you breathe in, you're not doing anything. The breath is doing everything. Can you feel it here in this position?
Not here.
Right? So the other position is better for Lucy. The cool thing is as she works on the child's pose, she'll start to feel it here better. Now, some people might not be able to do child's pose. You can even get just a simple knees to chest. So go ahead and come to knees to chest. And start having them see if they can feel it with knees to chest. You feel it? She can feel it there. So with Lucy, she probably really needs something close, like her thighs close to her belly, to make sure that the air is getting all the way down to her pelvis and not stopping at her belly. And that's going to give that good pelvic floor motion. So yeah. Feel free to ask any questions, and thanks for listening.